Cześć! Jesteśmy w Poznaniu w Versus Medicus. Właśnie po raz pierwszy w Polsce odbywa się u nas szkolenie z manipulacji powięzi według Stecco, level 4. Jest z nami Antonio Stecco, który opowie nam o tym, czym jest manipulacja powięzi, na czym polega to szkolenie i dla kogo ono właściwie jest. Okay, so we're going to talk about fascia and fascial manipulation as an actual method. So we're going to start off from the basics. So what is fascia actually?
Well, this is like the question, because fascia is a t-shirt that everybody should know. It's present in all the books. But what we have done is, study in depth this tissue and understand that this tissue is not an irregular mesh, but it's a multiple layer structure that is working for mechanics, but also is extremely innervated, where we more than tendon and ligament. And this give him a particular characteristic to be, a proper sexual structure, a structure that can perceive the body in the space.
What's the main function of fascia then?
So fascia works for load transmission. It helps with the connection of the muscle to transmit load far away. So it makes like a bridge that bypass the joint and give a better leverage to the muscle. So it give you more power, more load transmission. And on top of that, of course, we call it the organ for proprioception. Is the structure that permits, through the rich innervation, to perceive the body in the space.
And what alternations can it have?
So fascia can have a different alteration because it's made by dense connective tissue called type 1, type 3, and loose connective tissue, so adipose cell, glycosaminoglycans. So it can have two possible alterations. One we call fibrosis, and one we call densification. So fibrosis means an exceed amount of dense connective tissue, like a scar tissue. That it can happen with surgery, with trauma, with bleeding. That, of course, is a major alteration. It takes a while to be restored. But what is very common, is something new, is the densification, is the change of the loose connective tissue that become more viscous, more sticky. And that will impair the gliding. So what happened? The fascia doesn't glide anymore, so you have a restriction. You have the typical stiffness that everybody complains, as well as an irritation of the free nerve endings. So a painful afference that is so-called like non-specific musculoskeletal pain.
And what symptoms do patients usually have, and how it actually can be treated with the method?
So patient will suffer of what is called like a rigidity. The patient will say, look, I feel stiff, I feel limitation in range of motion. If I move, I feel pain. But all the investigation doesn't show up so much because the alteration of fascia cannot be visualized with a regular X-ray or MRI until it not so bad that can generate an alteration for the poor biomechanics in the joint. So patient will complain pain as the first, lack of range of motion, lack of strength, because you will not allow the muscle spindle to recruit all the motor units. Lack of proprioception, so you can have a functional ankle instability, okay? And on top of that, this can generate a general poor biomechanics, so the quality of the performance of the patient or the athletes is reduced. There is a way to treat this problem, and the problem can be treated of course, in multiple ways. But a shorter, a straight way to approach this tissue is to try to restore the gliding. Of course, with a manual technique that give you the possibility to be more flexible, more ergonomic. But we don't exclude that the other modality in the future can be important, because we saw some preliminary data that the shock wave can be helpful. Even other deep method can be helpful. But the advantage of the manual is that you have a constant feedback of what's going on. You can be way more precise, and of course, way more cheaper and efficient.
Okay. And what is fascial manipulation method? Like, what is it in general?
So fascial manipulation method is, as I say, is a method. It's not a technique. It's a way to assess the patient to figure out what has to be done. Of course, it's a guideline that helps you from the patient that walk in your office to teach you how to assess, how to evaluate, how to palpate, how to treat, how to plan even the next session. So fascia manipulation was found by Luigi Stecco, more than 50 years ago. And this method is based on the manipulation, so deep manipulation over specific area of the fascia that are critical for biomechanical point of view. So it's a shortcut because instead to palpate, random entire body or the area of the symptom to try to figure it out if there are, like so-called trigger point, we palpate specific area that we know that are important. In majority of the time, these points are far away from the area of the symptom, but critical to generate correct biomechanics in the area of the symptom. That is what makes it very different, this method from other techniques.
Okay, that's great. Can we talk about different levels, like different stages that you can actually do as a therapist? So there's like 4 levels. And what's level 1 about? Like, because it's actually the start. Like, what is it about?
Yeah, level 1 is the first level where we start to introduce the biomechanical model. We start to introduce exactly how we represent the body in the 3 plane of the space. We try to teach what muscle and fascia work together to move in the 3 plane of the space properly. So during this course training, you will learn specific spots that we call center of coordination, are centers that allow you to coordinate the activation of synergic motor units that work for one direction in the space. So through this course, you will learn how to, take care of symptoms that are related to mechanics. So I have pain when I move the shoulder. I have pain when I'm walking. I have pain when I'm lifting. So all the pain that are strongly related to mechanics can be easily resolved with the level 1 FM course.
Right. What about level 2? Like, how is it going to improve like the skills of an actual therapist?
Well, level 2 will start to explain what we call myofascial diagonal and myofascial spiral for movements that are more complex or for symptoms that occur without movement. So we'll have patients say, look, my shoulder hurts during the night. My shoulder hurts when I drive back from a tennis game. But, I still be able to play. Or sometime when I do a service, it hurts, but I don't really know when exactly. So complex motion or no motion require like a more complex integration of vector generated by muscle and fascia. So through what we call the center of fusion, so other set of points that work for complex motion, we can manage the more sophisticated motion that the human body has, and we can restore this. So of course, this will allow you to tie the bra. Sometimes it's a complex motion. Pick up the wallet, that is a complex motion. So everything that is a complex, that is most of the time difficult even to reproduce in the 3 plane of the space, it would be like the best target for our treatment, and so the knowledge that you will acquire with level 2.
So I've heard level 3 is actually more related to internal problems. Could you tell us more about it?
Yeah, well, we have a lot of visceral fascia, or want to say the visceral fascia is even more common than the musculoskeletal. In some way are more understood from clinician because everybody knows about parietal peritoneum, about the mesentery, about suspensor ligament, but there are too many names that doesn't help the clinician to understand the continuity that we have at the visceral level. At the visceral level, the continuity and the interface made by the visceral fascia are extremely important because each organ has its own mobility and motility. So in order to function, they have to have an independency. Think about how intestine should move differently from the bladder, and from other organ around. So the ability to move separately is allowed through interface made by visceral fascia. So as soon as you have a lack of gliding, too much tension, a container that becomes rigid, that will affect the function of the organ, so you start to have a dysfunction. This is important words because we don't treat pathology, but we treat dysfunction. But remember, irritable bowel syndrome is a dysfunction. There's no organic alteration. So any symptom that can be major can really affect the quality of life. but are not related to anatomical change can really be improved if it's not fixed by fascia manipulation level 3. That through a restoration of the container, through a restoration of all the fascia that from the container, from the wall, get to the organ, we allow a better mobility, better motility, better function, and so we restore all these symptoms that a lot of time doesn't have any imaging or investigation that show up pathology ongoing.
So there is a lot of publications about superficial fascia, and I feel like there's not enough recognition of that yet. Could you tell us more about it?
Yeah, let's say superficial fascia is the last frontier. We recently published a lot of articles about that. We got different grants to support the research in this topic. Because I know is called like a really Cinderella. It's something that is not fully understood, fully recognized worldwide. But it's a tissue that is important. I mean, it's present all over the body. Is in the middle of our adipose tissue, but it's really the full topic of level 4. Level 4 will really help you to understand why this tissue is so important, what symptom can be related to that. Because superficial fascia is extremely innervated. After the skin is the most innervated tissue with a lot of autonomic free nerve endings that work for thermoregulation, for sensitivity, for thermoregulation with sweating capacity, with pilar action capacity. But just imagine how important can be related to the lymphatic drainage, okay, to the composition of the adipose tissue. So an alteration of the superficial fascia can be easily generate lymphedema, can easily generate like a renal problem, paresthesia, can easily generate like a painful cellulitis. So all symptoms and syndrome that are extremely common nowadays and are most of the time difficult to be understood and treated. So thanks to the knowledge that will be acquired during level 4, you will be able to understand how to assess. Even if the patient looks normal, the palpation will help you to figure out when the disorder is starting. So you can do prevention, you can avoid symptoms that are still ongoing on and off. And so you can, take care of this extremely common symptom that can be exposed in the surface, okay, so alteration of the skin, of the subcutis, but it can also affect the internal part of our body because through the connection with the autonomic nervous system we call prevertebral ganglia, paravertebral ganglia, improper subcutis, so skin, superficial fascia, will affect also our internal organ. And so it can generate a vicious circle that will generate a major syndrome like fibromyalgia. Fibromyalgia is a typical situation that requires a level 4 approach in order to improve. And we know how common it is, and we know how difficult it is to treat this patient.
And what could you say to therapists that are thinking about taking on fascia manipulation course?
Well, I mean, what everybody's saying that fascia manipulation is the highest scientific based method that help you to understand the tissue, all type of fascia. We talk about the deep fascia, we talk about visual fascia, we talk about superficial fascia. Again, it's not a question of believe or not believe in fascia. It's a question to say, look, fascia is a tissue. It's the same important if it's no more than bone and muscle. So it's just a pity that is not teaching during the education university. It's just a problem that nowadays is not material in the curricula of all the healthcare professionals. So due to this lack of knowledge, it's urgent that people get aware about the importance of this tissue and the role in this tissue in a lot of syndrome and symptoms the patient have. So, my really recommendation is to, in any case, get aware about what this tissue is and, try to see our, literature. We have more than 300 articles in PubMed. See how important it is. And, take in consideration that, the training fascia manipulation can be a really way to, give a switch of your clinical practice, get better result and sooner result.
Okay, that is great. I feel like we covered pretty much everything. Thank you for the conversation. Thank you for giving us all the information. It was great to have you.
Well, thank you for the interview. Thanks so much.
Thank you.